Ready? Hello.
Hello students, is yours
Ready, huh? Hello. Very good evening. Very good evening to all of my dear students. This is Dr. Mufakkharul. Welcome to you all from ENT department. Today we will discuss on a very relevant topics for exam as well as in your lifetime. The topics is Menieres disease. Actually, we feel so sorry that we cannot start our class uh, at the right time because of some technical problems. However, hopefully, we hope that all of you are staying safe and well in your own places. Now, the topics is Meniere's disease. I hope that you can see my screen. Here you see the Meniere's disease, and the disease name here is placed is a different way. Something placed over the words like this and this. It is nothing but the French word. This disease is named after the French physician Prosper Menieres, who gives the idea in the year 1861. Before to start the discussion, we just make it a good protocol how to move our discussion. We just make it as definition, epidemiology, pathophysiology, diagnostic criteria, and then how to diagnosis, finally how to manage the patient. Now, the definition. Meniere's disease is an idiopathic venereal disorder characterized by recurrent spontaneous vertigo accompanied by fluctuating or progressive sensory neural hearing loss, tinnitus, and oral fullness in the affected ear. By definition, we can see the total disease preview. Here we can able to see some symptoms that are number one, vertigo. It means sense of spinning, and then sensory neural hearing loss is another symptom, and then tinnitus. It, tinnitus is nothing but the feelings of ringing sound. And then finally, oral fullness. That means something heaviness in your ear. Now, the epidemiology of the disease. Basically, the exact incidence and prevalence of the disease is still not known. And the age onset is reported to second to sixth decade of life. However, it can also seen in pediatric group as well. Not much, but not less. See the number 1 to 7%, not much or not less really. Surprisingly, 9% of all patients experience that start of Meniere's disease at the age of 65 or more. And there is no sex difference between male and female. Now I am giving some clue for the future scope of study, because science is very revolving and the changes has been happen for the last decade is very much. So here we mention some genetic code. These codes basically are concerned for the future scope of this scientist. For example, forget this. Now come on the pathophysiology. What happened in this disease really? Basically, it is a disease of inner ear. By this time, we all know. Inner ear has three parts. It's a complete bony membrane. The parts of inner ear are cochlea, vestibule, and the semicircular canal. Cochlea is concerned with the auditory component. Vestibule and semicircular canal is concerned with the valence. Now, see, the exact cause of Meniere's disease is not known. So, based on a large number of human temporal bone study, it suggests endolymphatic hydrops, means some way, as we still not know the exact cause, the pathology is some way changes in the inner ear, means accumulation of the fluid into the inner ear causing endolymphatic distension and produces these symptoms. And there are some potential etiological or precipitating conditions which include genetic variations, infection, vascular risk factor, diet, allergy, autoimmune, and endocrine factors. This is basically a recent idea, as we are following an authentic book where we get this diagnostic criteria for the Meniere's disease. See the criteria. For proper diagnosis, we need to follow this criteria, where we can see two definitive spontaneous episodes of vertigo. I am telling again, two definitive spontaneous episodes of vertigo lasting for 20 minutes to 12 hours. And it has to be audiometrically documented. Low to medium frequency sensory neural hearing loss in the affected ear. And or fluctuating oral symptoms, means tinnitus or oral fullness in the affected ear. This is the classical criteria for diagnosing this disease. Now, how we deal with this disease? For proper diagnosis of the disease, we need to go for a thorough history which include autovestibular history, family history, personal drug history, trauma, any surgical history, and other related disease history. These books, for this time, they avoid any differential diagnosis because they came to almost a conclusive protocol for diagnosis of this disease. That's why they are thinking no need to make it clumsy. So what are the diagnostic tools to be used for diagnosis of this disease? Number one is electrocochleography, called ECOG, and then MRI scan. And this is the new sort of investigation tools which use nowadays in the updated world. It's called cochlear hydrops analysis masking procedure, in short CHAMP. Why I have mentioned this in my slide? Basically, I'm telling you earlier that the science is going to evaluating more and more. So you need to be clear. You need to get some idea about the newer things. That's why I mention it here. So I'm telling, don't make it clumsy. For the exam purpose, you can just say electrocochleography and the MRI scan would be the gold standard investigation protocol for diagnosis of the disease. Here we just try to place a slide of an MRI scan findings. See, in next time hopefully we can give an idea about the reading of scanning system of the cochlea or something else. Today I just drop it. Okay. As we mentioned, vertigo is another classical symptoms. By book, the definition of the vertigo is the sensation of motion when no motion is occurring relative to Earth's gravity. And this, we can also assess this vertigo by using some tools. Among them, electronystagmography is one of the important one, and newer tools is introduced here. It's called Dizziness Handicap Inventory, in short DHI. Other symptoms is hearing loss. It is low frequency sensorineural hearing loss. You will get the hearing difficulties as neural component at low frequency level. How to assess the hearing loss? By doing a simple test called fifth tone audiometry. Here we show an audiometric evaluation. On the right side, you see a curve is supposed to going down at its right point. It's called low frequency curve down. In Menieres disease, you will get these findings. And finally, tinnitus and oral fullness is the other symptoms, which also can be assessed by doing some other tools like visual analog scale and tinnitus functional index. These are all newer things which added in the running authentic books. After diagnosis of the disease that you are thinking that's a patient of Meniere's disease, or confirm your diagnosis by doing so and so, that means MRI scan, electrocardiography, electron this and that. Now, how to manage this patient? I'm telling you, it's really terrible condition. You will see this sort of patient in your lifetimes at least once, or sometimes several times. Or even you may face this terrible situation in your family. So you need to take a clear concept about the disease, and finally how to manage. That means management. Again, I am telling you that it is a disease of Meniere's. So Meniere's has balance component and auditory component. That means it concerns with the balance as well as hearing. By this time, we can able to understand what's happening in the disease process. Now the management. Management is divided into here two parts. One is medical management, another is surgical. So medical management. Here we'll advise about some dietary hygiene. And especially we advise our patient to avoid salt containing food. It means low salt diet and caffeine free. The thing is that this salt means sodium may increase the fluid volume in the inner ear. So we advise our patient about this type of food and habits as well. And what are the medications are used to managing this patient? There are a number of drugs are using for managing this terrible disease. These are diuretics. Among diuretics, popularly used hydrochlorothiazide, acetazolamide, or even combination of diuretics with with tirametrine are still the first line medical therapy for Meniere's disease. And other drugs are beta-histine hydrochloride. It's very popular. We are using this drug in our clinical practice very often, as it is a very popular drugs in our country. Here I mention how to use. Basically, most affected groups of peoples are second to sixth decade of life, so that Drug can be used as 16 milligram of beta-histine dihydrochloride thrice daily with or without diuretics. What are the other medical options of Menieres management? Intratympanic injection of corticosteroid is one of the very well recommended option of treatment. It's nothing but the placing of steroid injection into the tympanic membrane. You can use your endoscope or under the microscope. And then second most popular therapy is intratympanic injection of gentamicin. Here, this time, the science introduced a new option of treatment. It's called transtympanic low pressure therapy. During our word class, we'll discuss in details. For the examination purpose, you just write it here or take an idea about these drugs or this therapy can be used for Menieres management. And finally, if you cannot manage your patient by placing the medical treatment with these components of drugs or therapies or ways, then you need to go for use other option. What is the other option? Is nothing but the surgical option. So let's see what are the surgical management of the Meniere's disease. A number of surgeries can be done for managing this intractable Meniere's condition. These are number one, endolymphatic sac surgery, and number two is selective vestibular nerve section, and then tenotomy of the tensor tympani and stapedial muscle tendon. Well, tenotomy of the tensor tympani and the stapedial muscle tendon is another newer option of the surgical management for treating Meniere's disease. Endolymphatic sac surgery is very popular everywhere in the world. It is nothing but just doing an exploration of the mastoid and tracing your endolymphatic sac and make a shunt or even by capping. Another is selective vestibular nerve section. If I try to make a good view, here you see vestibulocochlear nerve has two components. One is for the vestibular part, another is the cochlear part. So vestibular branch of the vestibulocochlear nerve which gives the supply to the vestibule, which is concerned with the disease. Once the patient cannot manage by any way, the final step to dissect this branch and desensitized or make paralysis of this area, and resulting the symptom has been gone. So these are all ideas about the Meniere's disease. If I recapitulate of the today's disease, what we learn. See, দেখছেন এখানে প্রথম স্লাইডটা, প্রথম স্লাইডটা এই। So these are the things we have learned in today's class. Number one is definition and how to develop this condition. That means pathophysiology, how to diagnosis of this condition. It means what are the diagnostic tools or criteria can be used for diagnosis of this disease, and finally management. So these are overall of this today's class. Okay, any query or anything you feel, any difficulties if you feel, let me know, either by
Comment.
either by sending some comments